adapting and knowing what the barriers are and how we can divide and support and come up with roles for our team members is essential.
That's Dr. Pavani Chalasani with George Washington University Cancer Center. We'll hear more from her up next. Welcome back to the award-winning Cancer Buzz. I'm your host, Summer Johnson. The George Washington Cancer Center's breast cancer program uses a community-informed model to manage care and adverse events related to CDK4/6 inhibitors. This is important because the center serves a diverse population in the Washington, D.C. area, racially, ethnically, and socioeconomically. Dr. Pavani Chalasani is the Division Director of Hematology Oncology at George Washington University. Cancer Buzz spoke with her about how her center uses a flexible and collaborative team design so they can provide culturally responsive and comprehensive care.
We have a remote nurse and an in-person nurse in the clinic, and they tag team.
Once they've seen the patient in clinic, the remote nurse steps in to ensure the patient's able to adhere to their treatment.
We call the patient, walk them through on how to take the medicine, what are the labs which need to be followed, what are the supportive care medicines they need to have ready, and call the patients, every few days to ensure they're able to keep that. And then we slowly extend those intervals. We remind them about the lab draws and we call them because our patients do have significant barriers and need those additional reminders.
Chalasani shares the challenges with speaking about clinical trials with the patient population they serve.
One of the challenge is understanding and explaining about treatments, follow-ups, and clinical trials and new treatments which are coming in. There has been, because of previous historical experiences, certain communities do have a sense of distrust in clinical trials, rightfully so, but explaining the trials in detail and having navigators who are members of the same community they come from.
That's where the team's community-centered navigators make a big impact because they bring firsthand experience to the job.
Our navigators who are members from the community but a part of our treatment team help really bridge because they're able to have a connection with the patients just coming from the same areas, neighborhoods, to kind of explain what it is and how things are, and also sometimes give us an understanding of where the hesitancy is coming from or what the concerns are coming from so that we can do a better job explaining and overcoming those barriers.
Patient education and clear communication are key to delivering high-quality care. Chalasani recalls how her team worked with one particular patient to lay out her treatment options.
There is an observational study that we also had, which is considered relatively low risk. Like she would be on the same treatments, but we would also be looking for certain other markers while she's continuing her standard of care. The patient initially said, okay, but then later was not sure. She wasn't able to give me a clear answer on what the barrier was.
When miscommunication or confusion happens, that's where teams know to dig a little deeper. Community navigators fill the gap by working with patients to understand their barriers.
We brought up the issue with the navigator who actually went in and talked to the patient to understand what the barrier was. And there was actually no barrier, but I think the patient was under the impression that the trial would be experimental and just because the amount of information she was given. So that actually informed us on how to separate our discussions and how to give time in between introducing certain concepts and doing it separately to give patients time to process and try to help us there.
Thank you to our guest today. You can head to the show notes for more on CDK4/6 inhibitor management. Until next time, for the Cancer Buzz team, this is Summer Johnson.